You monitor the standard ECG leads, like 1, 2, or 3, with this ECG cable. You can also monitor the ECG with these therapy electrodes, otherwise known as quick combo electrodes. These electrodes can be used for monitoring, pacing, defibrillation, and synchronized cardioversion. First, we'll cover the standard leads using the 4-wire cable. Attach it to the green port and turn on the monitor. Now the electrodes. You've probably gotten by applying ECG electrodes without skin prep, and the tracing was okay, but more likely than not, noise is going to be a problem. You can save yourself a lot of time by following these basic recommendations to decrease noise. Put the electrodes on the lead wire first before you apply them to the patient. Choose a site with minimal hair, or shave the site. Scrape the skin like this with the electrode backing to remove dead skin cells. Secure the ECG cable to prevent tugging on the lead wires and electrodes. Okay, electrodes are on. Select the lead you want to monitor. If you see a dashed line and paddles, press lead just once to automatically select lead 2. If you want to change the size, press size until you get the size you want, or use the speed dial. Now let's monitor with the therapy electrodes. Clear clothing from the chest and prep the skin for good contact. Don't put electrodes over medication patches, ECG electrodes, or implantable devices. Wipe the skin clean and dry if necessary. Shave the sites if necessary. Now, look at the picture on the therapy electrode. This one goes on the patient's upper right torso, lateral to the sternum and below the clavicle. Press it down firmly to get good contact. Place the other electrode under the arm. Place it lateral to the patient's left nipple in the mid-axillary line. Connect the therapy electrodes to the therapy cable. If you don't see an ECG, you need to switch to paddles lead. Press lead once, and it will automatically change to paddles lead. That's ECG monitoring. Remember, the monitor screen is intended only for basic rhythm interpretation and not ST segment or other diagnostic interpretation. For that, you'll need to obtain a 12-lead ECG, which is covered in the 12-lead section.
STEMI management is a priority in patient care, and the 12-lead ECG is necessary for diagnosis. To obtain an accurate 12-lead ECG, proper electrode placement is crucial. Let's go over how to do that. With practice, you'll get very quick at it. Just like ECG monitoring, we have the limb leads, but for acquiring a 12-lead ECG, we need to put the limb leads out here on the limbs. You can put the electrodes anywhere along the limbs, just not on the torso. Okay, we have the limb leads on. Let's do the precordial leads. Now, we're going to position these leads around the patient's heart, here. We recommend finding the right spots like this. Start with your finger at the notch in the top of the sternum. Move it down until you feel a little elevation. That's the angle of Louis, where the manubrium joins the body of the sternum. Move your finger to the patient's right a little and drop it into the second intercostal space. Down a little to the third intercostal and one more to the fourth intercostal space. Put the first electrode right there. From the first electrode, run your finger across the sternum to the fourth intercostal space on the patient's left. Place the second electrode right there. Next, we're going to skip over the third electrode and place the fourth. Move down to the fifth intercostal and then to the mid-clavicular line, right there. Place the fourth electrode. Now go back and put the third electrode halfway between the second and fourth electrodes. There. Good. The fifth and sixth electrodes are both at the same level as the fourth. Put the fifth on the anterior axillary line. And put the sixth on the mid-axillary line. Good. Now, Before we acquire a 12-lead ECG, let me make a couple of other points about electrode placement. With a female patient, you might need to place the 3rd, 4th, 5th, and 6th leads underneath the breast rather than on the breast. You can see how the placements are adapted in this particular case. And never use the nipple as a reference for lead placements on either men or women. Nipple locations just vary too much from patient to patient. Okay, all the electrodes are on. Connect the precordial lead attachment to the ECG cable like this. Ask the patient to lie still and push this button to acquire a 12-lead. This is the first 12-lead ECG for this patient, so the age menu appears. Use the speed dial to enter the patient's age and sex. Both are important for the analysis algorithm to provide correct interpretive statements. If you don't enter anything, the defaults of 50 and male are used for the interpretation. It will take a few seconds to acquire the data. It acquires a 12-lead ECG, analyzes, stores it, then prints it out automatically with lots of useful information. Here's the printout. This is an example of a 3-channel standard format. Other formats are available. Notice the word unconfirmed at the top of the report. This means that the algorithm's interpretive statements should only be used to prescribe or withhold treatment when the ECG waveform data has been confirmed by qualified medical personnel. There's a feature of the LifePac 15 you should know about called ST trending. It can be very useful in STEMI management. Be sure to watch the section on vital sign and ST segment trends and read about it in the operating instructions. Okay, now one thing that can go sideways is when you press 12 lead, you might get this message: noisy data. Press 12 lead to accept. The noise is usually patient or electrode related. So here are some preventive things you can do to avoid common sources of ECG noise in the first place. Use fresh electrodes from sealed packages. Develop the habit of a brisk skin prep. Make sure the patient is warm and comfortable with arms and legs supported. That goes a long way to reduce noise from muscle tension. Try to wait at least 30 seconds after applying the electrodes before you press 12 lead. Electrodes need a little time to stabilize. Secure the lead wires and the cable to eliminate any tugging on the electrodes. When the noise is eliminated, the 15 automatically completes the 12 lead report. If you've done everything you can but the noise still persists, look for electronic interference from radios or other electronic equipment. And, like the message says, you can press 12 lead again despite the noise. The 12 lead ECG will be printed, but without the interpretive statements. If you have to defibrillate, be sure to remove all the electrodes that could interfere with therapy electrode placement.
Oxygen saturation, carboxyhemoglobin, and methemoglobin monitoring are known as SpO2, SpCO, and SpMet. Together, all three are known as rainbow set technology. Your LifePac 15 monitor defibrillator may or may not have the capability to monitor all three. There are two ways to check if your device has CO or MET. The first is to watch the screen closely when you power on the 15. All the vital sign capabilities display briefly. Watch the SpO2 display area here closely during startup. There. This 15 can do all three. If it were only capable of SpO2, you would have seen only SpO2 during that flash. The other way to check is to highlight the SpO2 area and click it. You'll see what you have available here. If you want to monitor SpO2, CO, and MET, you have to use a rainbow sensor. If your sensor is only capable of monitoring SpO2, you won't be able to monitor CO and MET. But in this case, both our monitor and our sensor are capable of all three. So, the monitor's on, connect the rainbow sensor here firmly. Now the rainbow sensor looks like a standard SpO2 sensor, but to accurately measure SpCO and SpMet, proper sensor placement is much more important. The preferred side is the ring finger of the non-dominant hand. Put it on the patient like this, with the cable on the back of the hand. Slide it on until the finger tip touches the raised stop inside the sensor. Good. Shield the sensor from ambient light and have the patient hold still while it self-calibrates. Calibration can take 15 to 30 seconds. Confirm that the reading appears and is stable. If you use SpO2 alone, without ECG monitoring, the SpO2 pulse rate is shown here. The height of this bar indicates the quality of the signal. If you want, You can display the SpO2 plethysmograph, or pleth waveform, on the screen. Use the speed dial to outline channel 2 or 3. Click it and scroll through the channel menu to select SpO2. The waveform is automatically sized for optimum viewing. Now let's look at SpCO and MET. When the patient is connected to a rainbow sensor and we have a good SpO2 reading, SpCO and SpMet are also monitored continuously in the background. When the patient's CO or MET is abnormally elevated, for example, the patient's CO goes over 10% or MET goes over 3%, an advisory occurs. There's an alarm tone, an advisory message, and the elevated value starts flashing here instead of the SpO2. To acknowledge the advisory, press alarms. The SpO2 replaces the CO value, but the advisory message stays on the screen until the value drops below 10%. The SpMet advisory works the same way. So, if you are monitoring with a rainbow sensor and there is no advisory, then you know that the patient's CO is less than 10% and MET is less than 3%. But if you want to check those actual readings, there are two ways to do it. You can press print and get a printout of the vital signs. You see the CO and MET values up here on the strip. Or you can manually display the value in the SpO2 area. Rotate the speed dial to outline the SpO2 area and press it. Select Parameter from the menu, and then select SpCO or MET. The value displays for 10 seconds, then reverts to SpO2. If you have difficulty getting a stable signal or the value shown is questionable, consider these factors. Is the sensor size correct for the patient? Consider using a pediatric sensor for adults with small fingers. Is the sensor aligned properly on the patient's finger? Try taking it off and putting it back on again. Make sure the tip of the finger touches the raised stop inside the sensor. Is the sensor too tight? Is the site well perfused? Some patients have different levels of perfusion on different fingers. Try another finger. If there are notable temperature differences, use the warmer finger. Is the patient moving excessively? If so, get the patient to hold still or move the sensor to a less motion-prone location. It's especially important to keep a rainbow sensor motionless during its self-calibration process. Is there interference from bright lights like sunlight or emergency lights? You should cover the sensor to block the light. Again, that's particularly important while a rainbow sensor is self-calibrating. If the readings still seem questionable, get 2 or more readings from different fingers and average them. And remember, it's important to be familiar with your sensor's instructions for use. The SpO2, CO, and MET monitor has built-in messages to help troubleshoot problems that may occur. Refer to the troubleshooting tips and the operating instructions for the messages and corrective actions. Remember, SpO2, CO, and MET monitoring are tools to be used in addition to patient assessment.
So, let's take a blood pressure, or NIBP, with the LifePac 15 monitor defibrillator. Select the proper sized cuff for your patient. Put it on the arm nice and snug. The exact position of the cuff is not important because the cuff does not have a bladder. It inflates completely around the extremity. But don't put the cuff on the same arm as an IV infusion because it could affect the IV flow. Also, NIBP will affect SpO2 readings. Connect the tubing to the 15. Push it straight in until you hear a snap. The default inflation pressure is 160 millimeters of mercury, but if you have a pediatric patient or you suspect your patient's blood pressure is higher than 160, you may need to change the default inflation pressure. To change it, use the speed dial to select NIBP. Select Initial Pressure, then select the pressure you want. Okay, keep your patient's arm in a supported position, relaxed, and at about the same level as their heart. Tell them they'll feel a big squeeze and remind them not to move their arm during the measurement. Now press NIBP, and the 15 automatically inflates the cuff. It usually takes about 40 seconds to complete the measurement. Here's where the systolic, diastolic, and mean arterial pressures are displayed. If ECG or SpO2 is not active, then the 15 will show you the pulse rate from the NIBP here. So now you know how to take an initial BP. What if you need a recurring BP on your patient? Here's how to do it. Select the NIBP area. This time, select interval and choose how many minutes you want between measurements. We'll choose 5. Select Start or press NIBP, and the LifePac 15 will take a pressure at 5-minute intervals. Here are some important considerations. Patient motion can prolong the measurement process and may cause discomfort. Be sure the patient's arm is relaxed and that the cuff is not bumping against other objects. Patient arrhythmias can prolong the NIBP measurement time. If the monitor is unable to obtain a reading in 120 seconds, then it automatically deflates the cuff. If the cuff fails to deflate for any reason, or if it causes the patient undue discomfort, disconnect it from the tubing or remove the cuff from the patient. If you find it routinely takes a long time to inflate the cuff, there may be an air leak in the system. Check the cuff and the connections. There are messages built into the NIBP monitor to help troubleshoot problems. Refer to the troubleshooting tips in the operating instructions for the messages and corrective actions. Remember, NIBP is a tool to be used in addition to patient assessment.
End-tidal CO2 monitoring, or capnography, is another helpful tool in the LifePac 15 monitor defibrillator. Use it to continuously measure the expired carbon dioxide in adult and pediatric patients. It's important to be familiar with your filter line's instructions for use. Okay, let's set up for monitoring. You'll be working with these MicroStream accessories, either the airway adapter and filter line for intubated patients or a nasal filter line for patients who are not intubated. The 15 is on, open the connector door and connect the filter line. Turn the filter line clockwise until it is tight. There's a CO2 initializing message, and you see dash marks here for the respiratory rate. You can display the CO2 waveform in channel 2 or 3. Use the speed dial and select CO2 from the menu. The waveform will be a dashed line until the monitor finishes initializing. Then it becomes a flat line. Now, put the filter line on the patient, and there is your CO2 value and waveform. The monitor automatically selects the scale for the best visualization of the waveform. For your reference, CO2 must be greater than 3.5 for the waveform to appear, and at least 8 to recognize a breath and count a respiratory rate. The respiratory rate is averaged over the last 8 breaths. The end-tidal CO2 monitor has a built-in apnea alarm. Once a valid breath has been detected, the apnea alarm triggers if the monitor hasn't detected a breath for 30 seconds. The message, "Alarm Apnea," appears, and the time since the last detected breath. You can temporarily silence the alarm tone by pressing Alarms. First, check the patient and whether the filter line is still attached. The alarm clears when the next breath is detected. When you're done with CO2 monitoring, disconnect the filter line and dispose of it. Do not reuse, sterilize, or clean CO2 accessories. They are for single-patient, one-time use. There are messages built into the CO2 monitor to help troubleshoot problems. Refer to the troubleshooting tips and the operating instructions for the messages and corrective actions. Remember, CO2 monitoring is a tool to be used in addition to patient assessment.
Invasive pressure, or IP monitoring, can monitor arterial, venous, and other physiological pressures. The LifePac 15 monitor defibrillator can monitor 2 invasive pressures simultaneously. Okay, let's set up the 15 for invasive pressure monitoring. The first thing you'll need to do is set up your transducer system according to your local protocol. Make sure you're already familiar with the instructions for use of your transducer and infusion set. Position the transducer at the phlebostatic axis. Now, connect the invasive pressure cable to the transducer, and then to the P1 connector on the monitor. The default label is P1. To select a different label, outline and select the P1 vital sign area. Select Label, and choose the label you want. To see the waveform, use the speed dial to select channel 2 or 3, select the waveform, and the label you want for the waveform. The next thing we need to do is zero the transducer. Open the stopcock to air. and select 0 from the menu. When the zeroing is complete, the message P10 appears. Now close the stopcock. The patient's waveform should be displayed, and a scale is automatically selected to display the pressure. There are messages built into the IP monitor to help troubleshoot problems. Refer to the troubleshooting tips in the operating instructions for the messages and corrective actions. Remember, IP monitoring is a tool to be used in